Thank you. I appreciate those who can join us tonight or when they do get to see this. It is November 11th, so it is also Veterans Day, and we want to honor those who have given service. We hope some of you enjoyed our message that went out today. And for all who do service and provide service in the community. This healing circle is of particular interest and personal passion of mine as executive director of the Multicultural Health Institute. Because lung cancer is ubiquitous. It is the number one cancer and cause of cancer death. And I'm going to learn about how we might better prevent it or identify it early to give people a fighting chance. I personally on my journey was a caregiver and provided support and care coordination and navigation for my aunt who helped raise me and my mother, both of whom had lung cancer. And my mother, because of the newer evolving technologies and things, enjoyed an incredible dozen years of quality of life and incredible art production. And my daughter also has a very rare form of lung cancer, neuroendocrine lung cancer. And she also is enjoying an incredible quality of life and incredible art production. And we want to bring this message of hope. And we look forward to hearing more. I'm going to turn it over to our wonderful Vista Mia. And we thank you, Mia, for organizing everything, all the great graphics and messaging you guys seeing going out. Yay. And HI is still keeping our words going strong, even though the times are hard. We'll keep moving. So handing off to you, Mia, to
Thank
introduce
you
our
so
speaker for
much.
tonight.
So I will introduce. Amie has over 30 years of experience in healthcare, a career that has spanned a wide range of fields, including acute and intensive care, hospice and palliative care, and cancer prevention. She currently works in the early detection and prevention of lung cancer for Sarasota Memorial Health Nodule Program. Her programs have proven that early detection saves lives, with a significant shift to early stage lung cancers in her patients' populations. She has a master's degree for advanced practice with a focus of oncology and is a certified tobacco treatment specialist. Amie actively collaborates with Gulf Coast South AHEC, as well as participates as a member of the Sarasota County Tobacco-Free Partnership, both of which seek to decrease smoking prevalence in Sarasota County. She has focused to push forward a system-wide change to adopt early detection awareness and advocacy along with tobacco treatment in the SMHCS patient population. And I will turn it over to you.
Thank you so much, Mia. I appreciate it. And thank you for everybody for having me here to speak tonight, at the Healing Circle. As Dr. Merritt had said, lung cancer, is a devastating disease. It kills more people than breast, colon, and prostate cancers put together. So really, when you look at the volume of lung cancer new diagnosis, which is about 226,000 a year, and lung cancer deaths, which is about 125,000 a year, it's really staggering. And so, that is one of the job that I was tasked with here at Sarasota Memorial was really to figure out, create programs to help detect this lung cancer early when it can be treatable, right? And so, so about 10 years ago, we started our lung cancer screening journey. It was January 2016, we screened our first patient. We're actually getting close to screening, close to 10,000 patients so far, or 10,000 screening exams, and we've diagnosed close to 200 lung cancers, and 80% of them have been in that stage 1 or 2. So we're really, doing a good job with getting our patients, diagnosed early. The main problem that we're having is that we're not screening enough people. And sadly, screening rates across the nation are dismal. There are some pockets that are really doing a good job, like the state of Massachusetts and the state of Kentucky are screening close to 45% of the eligible population. We know there are over 14 million people that are eligible for lung cancer screening, and I'll talk about the eligibility criteria here in a minute. But sadly, here in Florida, I think it's like only about 12% are actually getting screened. So, really it's just very dismal. And, a lot of the advocacy that we're doing over the month of November, because it is National Lung Cancer Awareness Month, is to really help people understand and learn about lung cancer screening and early detection. I mean, everybody knows, that a woman age 40 and over needs to get a mammogram every year, right? People don't know that about lung screening, and it's really a sad truth. I mean, just last Tuesday, a week ago, Dr. Marshall, our thoracic surgeon, and I were actually at a community event in Lakewood Ranch, and nobody raised their hand when she asked how many people know that there's a screening exam for lung cancer. Nobody raised their hand. So it's really, really sad that we're not doing well. And I actually just read an article earlier today about how Florida really ranks very low when it comes to overall lung cancer treatment as well. So there's a lot we can do here in the state of Florida to really improve these statistics. So I do have a PowerPoint presentation. Mia, do you want to start that, or do you want me to do it, or how do you want to do that?
Sure, I can start it. I
Okay,
just need to
perfect.
give,
Awesome.
let me just change over permissions to Dr. Merritt in case anybody tries to come in. You can approve them.
Okay, awesome. So, essentially, when we talk about lung cancer here at Sarasota Memorial and the programs that we do, we really want to sort of focus on this fact that when lung cancer can be detected early and prevented, of course, we work a lot on prevention as well, we can save lives, and we've proven that here at Sarasota Memorial. So my next slide just talks a little bit about the overall statistics. And so if you can go on to the next slide, that'd be great. So this is information. I just pulled this from the SEER data this afternoon. So at a glance, there's close to over 226,000 new cases of lung cancer in 2025, and this really it's significant because if you think of all the cancers out there, it comprises 11.1% of all new cases. But if you go down a little bit and you look a little bit further, the estimated deaths are 100, almost 125,000, right? And that actually comprises 20% of all cancer deaths. So it is the number one cause of cancer death in the United States. Like I had mentioned, it takes more lives than breast, colon, and prostate put together. So it's really a significant issue. And as I learned earlier today, we are not doing so great in the state of Florida on a lot of different fronts. So definitely wanting to really help people understand in the community the significance of this cancer, this very deadly disease, and really help get some some acknowledgement out in the community for it. I mean, it's a little hard for me every year in October. Everywhere you go, right, you see pink, you see all these advocacy programs for breast cancer awareness. You see, all these events and these runs and these walks, and you see so much really pumped into October for breast cancer awareness. And I'm not saying that creating that kind of hype around breast cancer is wrong in any way. But my point is that we don't see the same thing for lung cancer, and it always makes me a little bit sad that lung cancer doesn't get the same attention that breast cancer does. And I'm wondering if anybody that's on the call or is listening has any idea why that is. And if you'd like to speak up and mention it, I'd be happy to hear what you think. Why is it? Do you think that lung cancer doesn't get the same attention that breast cancer does?
Blame the victim.
Right, because they're victims. We're blaming them because of,
Smoking.
right? Exactly. So unfortunately, lung cancer is attached to the stigma of tobacco use. And so I think it's really common, and I believe that, most people, they may not be, ill-intended, but, for example, when you hear somebody that, most people know somebody that has had lung cancer, right? Or a family member or a friend or something like, it's really common. And, when you are the person that has lung cancer, or you love someone that has lung cancer, and you go, in your course of your day, you may tell somebody, my loved one was diagnosed with lung cancer, or I have lung cancer. What do you think typically is the first question that comes out of people's mouths?
Are you a smoker?
Right,
Yeah.
right. Yeah. And so what does that make that person feel immediately? Stigmatized, right?
Right.
Like this was my fault. I did this to myself, that sort of thing. And so here at Sarasota Memorial, and I do believe that there should have been a bigger push to destigmatize lung cancer when lung cancer screening came out, because I believe that's one of the reasons why screening rates remain so dismally low. Is that it's so stigmatized. For example, we are Sarasota Memorial, the Brian D. Jellison Cancer Institute has a booth at the Sarasota Farmers Market, really every Saturday between October and April. But in November, my group has, charge of the table on the Saturdays because it's Lung Cancer Awareness Month. And we've had a lot of we have a lot of great support. We actually have, our thoracic surgeons are going to be there this weekend, our medical oncologists, pulmonologists. We have a lot of people in the Cancer Institute that are supporting this table. And sadly, when people walk by, it's like they don't want to talk to us. They don't want to talk to us. They don't want to acknowledge. And so when we start asking questions like, hey, do you have a tobacco history? They just like shun away. You know what I mean? They just really don't want to engage in the conversation at all. And so for me, it's really sad. I want to put a big sign on my chest that says, no judgment here, just get your lungs scanned, right? I don't care. I don't care if you used to smoke. I don't care if you still smoke. If you meet eligibility criteria, let's get you scanned and screened, because when we catch disease early, we can save lives. So that's, it's a big issue. And I just, I really do hope that we can overcome it someday, but it's going to take a lot of work. Can you go to the next slide, please?
Can I chime in here while you're switching up, Annie? I think it's also important that we speak about environmental factors and environmental toxicities, and
Yeah.
that might speak to radon.
Yeah.
And that it does happen to people who have never smoked or who stopped smoking many,
Correct.
many, many years ago.
Yeah.
So to make that presumption is really incorrect.
Well, 80% of lung cancers are directly related to tobacco use. The number one cause of lung cancer in a person who does not smoke is radon exposure. So that is something that is very significant, since 20% of lung cancers happen in people who don't smoke. We're actually learning a lot more about the genetics of lung cancer as well. And so whenever I have people that tell me that, oh, my parents had lung cancer, or my brother had lung cancer, they may not meet screening eligibility. However, there are studies that they can join that really are helping us understand the biology of these lung cancers to really help them, get an understanding about their risks for lung cancer. So this slide just really talks about, again, like we mentioned, so lung cancer is not necessarily the most common newly diagnosed. So breast cancer in women is, prostate cancer in men. But as you can see, the deaths related to breast cancer and prostate cancer are much, much lower. And really that has a lot to, I mean, with breast cancer, it has to do with mammography, right? Most women get their breast cancer screenings done on an annual basis. Same with men with prostate. Prostate cancer is more of an indolent disease, so it's not quite as aggressive as well. But as you can see, the deaths related to lung cancer, far exceed those for breast and prostate. So really, still a really significant issue. Next slide. So this actually, I like this. I found this today. It's a little video on YouTube, and it really talks about, it kind of goes through a woman's journey of quitting tobacco and then really understanding that, hey, I should probably get my lungs scanned. So, lung cancer kills 426 people every day. There's 18 deaths every hour, and about one death every 3.5 minutes. And, like I've been mentioning that, it doesn't have to be the case, right? When we can find lung cancer early, we can save lives. Lung cancer, there are no symptoms until you have more of a late stage. Late stage lung cancers, can come about with symptoms such as a cough, coughing up blood, shortness of breath, unexplained weight loss, chest pain, things like that. But by the time somebody is experiencing symptoms, oftentimes it's already in late stage. Early stage lung cancer, a small nodule in your lung that maybe measures a centimeter or two, isn't going to cause you any of those symptoms. So really getting screened is really, important. So are we able to play the video? I don't hear any sound.
I think when you do the share screen, you have to activate allow sound. Amie, are you organizing this? Right, to
Did you
make the
see, am
video
am I
run.
organizing this? Yeah, you couldn't see the
We
video?
Yeah, I
couldn't
could
hear
see
it.
it. We couldn't hear it.
Yeah, I'm trying to go back so it'll share the audio. Okay.
So this is just one video that I found, and I don't watch TV, so yeah.
Somehow I love. Oh.
Still not sure about the video, the sound.
Cool animation though.
It's just kind of, marking this woman's journey to quitting smoking, really showing the struggles. But finally to the point where she's like, no, I'm done with it. And she's, traveling and seeing her daughter grow up and now it's saying, you've smoked and now it's time for you to get a scan. And it's just showing her kind of through her lifetime. So the American Lung Association, has done that, has put on that campaign, and it's called Say by the Scan. So you can just kind of Google that. It'll also take you to a little quiz that you can take to see if you meet the eligibility criteria. So, I encourage anybody and everybody that may be listening or watching, if you're not sure, certainly talk to your doctor about it, or go to the website, Save by the Scan and see if you might be eligible for lung cancer screening. Okay, we can go to the next slide. So this is just a little bit more information, regarding lung cancer and, really sort of the tragic part of it is that, people who don't get screened, 73% of them are found in stage 3 or 4. And, like I had mentioned earlier, when we find cancers at late stage, makes them much harder to treat. For sure, stage 4, typically not curable. But stage 3 still is, you're looking at a lot of treatments, and those could include, chemotherapy or radiation, maybe a surgical intervention, those sorts of things. But really, when we can find lung cancers in stage 1 or 2, typically, surgical intervention or maybe some radiation therapy is what's needed, and then surveillance to make sure nothing comes back. But certainly much easy to cure an early stage lung cancer. So that's why we really want to stress the idea of screening in people who are considered high risk. The next slide, please. So currently, these are the criteria. I'm not crazy about the criteria, but it's what the National Lung Screening Trial basically based their, the United States Preventive Service Task Force has based their results on the lung screening trial. So it's basically anybody between the ages of 50 and 80. I will make the caveat that the Centers for Medicare and Medicaid Services stopped covering this at the age of 77. So it's very, very frustrating that all these organizations these guidelines cannot be on the same page, but that's just the case. Someone who's currently smoking or has quit within the past 15 years, and the American Cancer Society, actually, their screening guideline recommendations remove that quit in the last 15 years, and the last year or so they've removed that part. But again, they're not the pay source, so we really can't go by their guidelines. We have to go by United States Preventive Service Task Force or CMS, and then have a 20-pack year history. And that basically means you smoked a pack a day for 20 years or more, or it could have been a half a pack a day for 40 years. So you take the pack and you multiply it times the years, and that's how you get a pack year history. And we know that lung cancer screening is one of the most immediate interventions that we can employ to reduce lung cancer mortality. But making sure that getting more people to get their screening done is really the key. And I always tell people that this screening exam is easier than a mammogram, and it's way easier than a colonoscopy. You literally lay flat on a table. You don't even have to change out of your clothing for about 10 seconds, and you hold your breath a couple of times. So really simple, quick, painless screening exam, and very effective in finding lung cancers at early stages, certainly. So the next screen. So here at Sarasota Memorial, like I said, we've diagnosed close to 200 lung cancers in our screening program, and 73% of them overall. Well, this is in 2024, but it's a little bit more than 73% when you look at all of them. So 73% of the cancers that we found in 2024 were actually early stage. So it's just the opposite of the non-screening population. So we're really proud of that. We certainly work really hard to, keep that momentum going. Our early lung cancer detection program includes our incidental lung nodule program, as well as our lung cancer screening. So what that means, if people are not aware of that, is that we have a program that tracks lung nodules, so spots on people's lungs that are found incidentally. So what does that mean? So basically that means that, Mr. Smith comes into the emergency room because he's having kidney stone pain. He happens to have a CAT scan done of his abdomen and pelvis, which actually images the bottom part of his lungs. And oh, by the way, we found a lung nodule on the base of your lungs. And so a lot of early stage lung cancers are still found incidentally like that. And we have a program here as well at Sarasota Memorial that can really identify and navigate and track people to make sure that they're getting the recommended follow-up. And we follow the Fleischner Society guidelines for our incidentally found lung nodules. So both of those programs really contribute to this overall stage shift for us as well. Next slide, please. Oh, and that's all I had. Just a short presentation. I think that having the conversation, about stigma and, increased awareness is really most important when it comes to lung cancer, and really, getting the word out about lung cancer screening. I think one of the things is that we look at ourselves and we may not be eligible for lung cancer screening ourselves. However, studies show that most people that aren't eligible actually know at least one person that is. And so one of the things, actually, I had met a bunch of college students in September that have what's called the American Lung Cancer Screening Initiative. And their initiative basically, they're college kids. So I thought, well, this doesn't really make sense because they're not eligible for lung cancer screening. They're not 50, obviously, right? So I thought, what is this all about? But I actually was really intrigued, and I learned a lot from them. And what I realized is they may be, 18 to 22, but they have parents, they have aunts and uncles, they have grandparents that probably likely somebody's eligible. So they are promoting a campaign called the Plus One campaign. And essentially it is the fact that, even though we may not be eligible or they may not be eligible, they know somebody, at least one person that is. And so really, I love the idea of getting this younger generation really engaged and understanding that there's a screening test for this most deadly cancer out there, right? And we need to get the word out, and we need to get people to really get in and talk to their doctors about this and get their screening exams. So I really love that. They're actually going to be joining me. There's a group, we've engaged with a group at New College, some students at New College, and they're going to be coming out on the 15th, on this Saturday. We're going to be at the farmers market. We're actually going to be having a big event, so everybody is welcome to come. We're going to have our thoracic surgeons there. We're going to have a big pair of inflatable lungs, so it's going to be really interesting. And just really want to spread the word with, for lung cancer awareness and screening and early detection at the farmers market on Saturday. And we'll be there on the 22nd too. So if anybody wants to go, we'd love to see you for sure. But yeah, so just
When we say
The
Saturday,
15th
that means
of
Saturday being, is that the
November. Yep, the
16th,
15th and the
15th
22nd.
November?
Yeah,
Yeah, that
we've
helps.
been out there the 1st and the 8th. So far, and it's like reception's sort of lukewarm, people don't really want to talk about lung cancer. They don't
So
want
we
to
need
talk
people to
about.
come up, yeah, and be happy and just show you some support and love for what you're trying to do to help people.
Yeah, right. Yeah. So,
What time are you
so
guys out
anyhow,
there from when to when?
7 to 12:30.
So
Yeah,
it's in the
the time.
morning.
Yeah, it's in the morning at the
And
farmers
where's the
market.
farmers market again?
It's on Lemon down like Main Street downtown Sarasota on Saturday morning. I think it's like Lemon and Main or some. It's right around that area where the Whole
Okay,
Foods is too. Yeah.
okay, so some people may not be familiar that we're speaking to, so that's great, and it's really nice to know that that's going on. Have any questions come in? Is anybody watching the Facebook to see if any questions might have come in?
Yes, let me look.
I have a question for you. How about vaping? Does that give the same type of risk? And do you get asked that question? And what's your
Yeah.
opinion about that, Miss Miller?
Yeah, so we get a lot of questions about vaping. Every day I get articles that come over my email about vaping and just really the tragedy that it is. Um, So I think vaping initially was developed many, like what, 20 something years ago as an alternative to smoking, right? But what the tobacco industry has done is they've turned it into a new product, right? And a new way to get people addicted to nicotine,
Right.
and make no mistake, I mean, nicotine is an incredibly addictive. I've had patients sit with me in an exam room almost in tears, just saying, I was able to quit using, crack cocaine. I was able to stop drinking. I can't quit smoking cigarettes. Can't do it. And the tobacco industry has spent millions and millions and billions of dollars to market their product, and they have targeted kids. I mean, you don't sell bubblegum flavored, e-cigarettes to really appeal to an adult, right? They have all these flavors, and so actually, that's the number one reason that children initiate using electronic devices is because of flavoring. So if you ever have the opportunity to talk to a politician, or vote in a certain way, really eliminating any flavoring and any tobacco products is really going to help decrease overall prevalence. So we really know. So a lot of people will say to me, well, the nicotine's not, not the harmful part of a cigarette. Well, we know that cigarettes are very harmful, right? Whenever you light something on fire and breathe it into your lungs, you're doing damage, right? Our lungs are meant to breathe air. And
Right.
so, so I always talk about that. But what you have to understand with vaping is that you're actually heating this liquid that actually does more than just nicotine in it. It's not just a harmless water vapor. It has heavy metals, nickel, zinc, cadmium. I mean, it's got all these things in it that are not healthy for our lungs and that are carcinogenic, right? But we haven't seen, 50 years of use of vaping to really understand fully. Although there are studies that are coming out every day, I see them coming through, the cardiovascular risks, the increases in blood pressure, the damage that it's doing to the vasculature, different things like that. So we know that it's not harmless. Right. This is something that actually is very harmful. Not to mention the fact that we're also learning more about nicotine and nicotine addiction. I mean, overall, people think, well, nicotine actually works to, help people with their anxiety. Well, it really doesn't in the long term. It's just a vicious cycle, and it actually is going to, over the long term, increase anxiety and increase signs of depression. And so, what we also know is that in the developing brain, so adolescents' brains, they really don't fully develop until what, about 25 or so. The nicotine is interfering with the neurotransmitters in your brain, and it's affecting the development of the brain. And so what we're also learning is that it's sort of priming the brain, the developing brain to be more open to other addictions. So they're more prone to other addictions. They're also prone to attention disorders. And also to increase anxiety and depression. So, and nicotine is incredibly addictive. And so, I was reading an article again earlier today about, how some teens just have to really like they wake up compulsively thinking about their vape. They'll wake up in the middle of the night to vape. They will sneak it in class. It's been designed and developed to look at like ordinary items so that they can try to hide it and mask it. So yeah, I'm really concerned. It's a real concern vaping the electronic devices, and not only that, now they're like Zyn. It's like a pouch, a nicotine pouch. So now, okay, is that safer? Well, now you're not lighting anything on fire, and it's not like tobacco, like chewing tobacco, where those carcinogens are sitting right next to your mouth, but you still have these enormous levels of nicotine that kids are being addicted to. And nicotine is a very, very challenging drug to stop using. It's very hard. Like I said, I had people tell me that it's the hardest thing they've ever had to do in their life is to quit smoking. And when you hear somebody that's desperate to quit and you hear that, it's just really a shame. And I love working with Dr. Marshall. Dr. Blair Marshall is our new thoracic surgeon. She came from the Brigham. And she's just really marvelous in a lot of ways, but she will always take the stance that, it's not their fault. The tobacco industry has purposely done this and rigged this to get people addicted to a product. And once somebody's addicted, they have a customer for life. And that's why let's get them young. You know what I mean? Let's get them addicted young so that we will have a customer for life. And make no mistake, the tobacco industry spends $25 million a day in marketing around the world just to push their products. So if you think about it, $25 million a day, what kind of good that money would do if it was going somewhere else, but it's just causing more harm. So it's really sad. But yeah, vaping is not safe. The bottom line is it's not safe, and it's not an FDA approved therapy to help people quit smoking. We really want, people to really stick to, the nicotine replacement therapy, the patches, the gum, the lozenges. That's what's recommended. So, good question.
Wow. Yeah, that's really a good overview. And I think there is a psychological component that people trapped in an addiction actually suffer. And
Yeah.
it starts off as a lark, and then they get hooked young. And the problem is getting hooked young as the brain is still developing makes it even that much harder
Hmm.
to break the addiction later. And it
Hmm.
is really sad that our children are preyed upon as an
Hmm.
economic opportunity.
I know.
And it very much disrupts that normal brain development because there are untoward effects we don't even understand of all of those chemicals
Hmm.
that are involved in those substances
Hmm.
and how they might interact with other conditions or other medications that they may be taking or might need to take. So we really
Hmm.
appreciate this very thorough overview that you've given us and the hope, because as with
Hmm.
breast cancer last month, and we were encouraging people to check themselves and to get checked
Hmm.
early and to check out lumps, and the early detection leads to great outcomes. We now have that option for lung cancer like we
Hmm.
haven't had before. We know that people that smoke are at higher risk and eligible for this screening, and it is usually covered by insurance, right, or from the grant.
Yep.
So it's not like they will have to pay. And it's really good to have peace of mind also if you go through it and you realize so far so good. And then maybe you're more motivated we have all kinds of smoking cessation products and
Hmm.
programs. AHAC we've been doing for years,
Yep.
encouraging people. It takes about 5 times, maybe 10
Hmm.
times for some people, but you can
Right.
do it. We have seen hardcore people do it. If you're going to face hip surgery or back surgery,
Hmm.
or God forbid, heart surgery or anything else that may be related to acceleration of degenerative changes because of the smoking, some surgeons will not operate if you're still smoking.
Yeah.
So there's a reason for that because it delays healing, it interferes with the blood circulation, it increases the risk of complications, of infections, of clots, of failure of fusions
Hmm.
and blood and bony union and things like that. So it's really, really a great idea to start working now towards your New Year's resolution. First you got to get ready to
Yeah.
think about it. And then we and other organizations are here to help people through it. You can do it. We just
Hmm.
encourage you to just keep trying. And then, Annie, we thank you for the service that you guys are doing. And I'm sorry, Amy. And you guys get out there to the farmers market. Let's give them some support, even while you're out there getting your apple cider and your cheese. And I guess there's still a few pumpkins rolling around. Get some information. Somebody. Everybody knows somebody who's still smoking,
Hmm.
who you care about and who you love. And they don't need a lecture, they need encouragement, they need support, they need not
Hmm.
judgment,
No
and
judgment,
they need a
right?
hand to walk with them. Just walk with them, and
Yeah.
let's get everybody swing. We should get those numbers up. That's
Yeah.
really a shame that we're so low. I didn't
Yeah.
realize it was so low.
Yeah, it is. And one other thing about like quitting, I always tell people don't look at your quit attempts as failures, like even if you quit for 24 hours, like you've gone 24 hours without smoking a cigarette. That's huge, right? And we learn bits and pieces of this is how I did it. You know what I mean? Or people will say, I've quit, 100 times before. And I'm like, okay, well, like what worked for you? Did you delay your cravings by, chewing on a toothpick? Did you like little tips and tricks, right, that help people understand what works? And these are tools that they can put in their back pocket to help future quit attempts. So yes, it takes about 8 to 10 quit attempts for somebody to quit for good. But every time you do it, you learn about yourself and you learn what works and what doesn't. And you learn your pitfalls, right? So like, what is it that made me want to go back to smoking? Or what was it that, and then you learn how to kind of cope with those moving forward. Whenever people tell me that, yeah, I quit for 10 years, and then I started smoking again, I always ask, well, what was the event that brought you back to smoking? And they can always tell me very clearly, like it was like yesterday, this is what happened. And so that's what I focus on with them. I say, okay, well, moving forward, when you quit again, you want to try to either avoid this situation, whether it's happy hour with your friends or being around a certain friend that continues to smoke or something like that. So, it's a process. It's a process, and I realize that. But we want to help people quit. We definitely want to help people quit, just like Dr. Merritt said. We want to support you. We don't want to judge you. We want to get you on the right path. So yeah.
Any other questions? Any other questions come in from what you can see so far?
No, we don't have any questions on Facebook.
Okay. Well, Amy, we really appreciate you, and we appreciate those who may have watched, and we hope that you will share it with your friends and revisit this. This was a really great talk and an encouraging one, and for all of those affected and all of those who have gone on, we just give thanks, and we will keep hope alive.
Yeah.
Absolutely. Thank you for having me.
And I hope to see you on Saturday.
Are you going to be there?
I'm going to try to be there. Yeah.
Oh, awesome. Okay. Would
See
love
you.
to see you. Yeah.
Okay.
It's right by, where Madison City Grill is.
Oh, yeah. I've
Basically,
been there many times. Yeah.
okay. So you can't miss it because there's going to be a pair of big inflatable lungs. They're
Okay.
10 by 10.
All right.
Oh, that's
So
cool. You guys are really going to get some
yeah,
attention.
yeah,
Yeah.
yeah.
Some
We have
attention.
some students. Could we direct them to perhaps volunteer with you as well if they just kind of find their way to you? We have some great
Yeah,
students.
I have new college students that are coming. I have little 10 by 10 cards. They're little cards and they have a QR code on them that helps bring people to a website at SMH that goes over the screening eligibility. So it's just like, are you eligible for lung screening basically? And I'm going to have my students hand those out. So if anybody wants to come, they can come. They just find the big lungs.
Yeah, I'm just saying, we also have some students we'd love to help to volunteer. They're looking for opportunities. If they could just join you and help hand those out, that would be really great.
Yeah, yeah, yeah. Yeah,
Okay.
absolutely. Yeah, sounds
Okay.
great. Just tell them to look
Great.
for me.
Thanks,
Great.
guys.
Thank
Okay.
Take
you.
care.
Thank you.
Good night.
Good night.
All right, good night.